Exercise reduces cardiovascular disease risk and overall mortality in a dose-dependent manner, and the mechanisms by which these reductions occur are not fully understood. One way in which exercise may improve a person's cardiovascular disease risk profile is through an increase in HDL cholesterol levels, or better yet, by improving HDL function. HDL cholesterol levels are inversely related to cardiovascular disease risk, but just raising the HDL cholesterol level may not be enough to reduce cardiovascular disease events. This is why the focus is shifting from emphasizing increasing HDL cholesterol levels to specifically targeting better performing HDL cholesterol and enhancing its functionality and quality. HDLs have several cardioprotective functions, including reverse cholesterol transport, or moving excess cholesterol away from the arteries and back to the liver for excretion, and they contain anti-inflammatory and antioxidant properties that inhibit pro-inflammatory substances to reduce inflammation. For example, one study showed that for every 22% increase in the ability of HDL particles to suppress inflammation in endothelial cells, there may be a 23% decrease in the likelihood of having a cardiovascular event during the next decade. Dyslipidemia is a term used to describe an abnormal concentration of lipids, triglycerides, and cholesterol in the blood because of elevated total cholesterol, LDL cholesterol, or triglycerides, or low levels of HDL cholesterol. Causes of dyslipidemia are varied, but the most common contributing factors include poor dietary and lifestyle choices in combination with the person's genetics. The good news is that improved lifestyle choices can profoundly impact an individual's blood lipid profile. For individuals with dyslipidemia, the following recommendations may be helpful for making evidence-informed decisions about becoming more physically active. Remember, these are targets to work towards, and for most people, they will not be a starting point. For cardiorespiratory exercise, work towards 30 to 60 minutes of prolonged rhythmic activity at an intensity where you can talk but not sing, or an intensity rating of 3 to 6 on a 0 to 10 scale. This should be done on at least 5 days per week. For muscular training, aim for 2 to 3 days per week at a moderate to vigorous intensity, doing 1 to 4 sets of 8 to 20 reps, depending on your specific goals, and targeting all your major muscle groups. For flexibility training, work towards 2 to 3 days per week, targeting all major body parts for 2 to 4 repetitions, and holding each stretch for 10 to 30 seconds. Both static and dynamic stretching can be used, and stretches should be held at a point of slight discomfort or tightness. Bouts of activity of any length contribute to the health benefits associated with the accumulated volume. In other words, every step, jump, hop, skip, jump, pull, bend, and lift counts. Do what you can now and add more when ready, but most importantly, get moving.